Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California. On today's podcast, I am thrilled to welcome back two of our previous guests who have teamed up for something really, really incredible here at UC Davis. Dr. Scott Akins is a developmental pediatrician and the medical director of the Mind Institute here at UC Davis. And Dr. Jonathan Kohler is an amazing pediatric surgeon. And together, along with a team of health experts in various fields, they're the co-directors of a program called PATH. It's a program designed to promote accessibility in healthcare for individuals with neurodevelopmental differences. Dr. Akins, Dr. Kohler, thanks for joining me today.
Good morning, Lena.
Good morning. Thank you so much.
So before we get into the details of the program, I'm hoping that you can both speak to how you became interested in doing this work and starting this program here at UC Davis. Dr. Akins, do you want to go first?
For me, the interest really came out of stories that we continually heard from families of neurodiverse children about struggles they had during hospitalizations. We also heard from our colleagues quite often that they felt not fully prepared to manage some of the sensory dysregulation that neurodiverse children would experience in the hospital, some of the communication differences or unique communication styles. And even simple things like kids that have a restricted diet, that's tough in the hospital when what shows up is, chicken a la king, right? And you eat 5 things. That's really tough. And we started to realize as we thought about this more and more that we have a lot of protocol-driven, somewhat rigid systems in the hospital that we need for good reasons to keep us safe and to keep us efficient, but that those don't work so well for folks that would benefit from an individualized care plan and a little more time, or kids that have difficulty waiting, for example. That was one big issue. And then the second thing is that we just came to realize that when those systems don't work for certain patients, what ends up happening is if you need to get a blood draw or a vaccine or even something really invasive like a spinal tap, a lumbar puncture, we do that with restraint, both physical and what we call chemical restraint medications. And over time, that really leads to a lot of medical trauma.
Yeah.
And then as that medical trauma adds up, children and families begin to avoid care, recommended care, something like a blood draw to maybe test their cholesterol level or their blood sugar level because they're on a medication that might raise those. We know that children with autism and intellectual disability get those tests far less often than they're recommended. And we thought that medical trauma was a big contributor to that.
Yeah, and potentially avoidable, or at least be able to reduce. Dr. Kohler, tell me a little bit about your specific experience as a surgeon and parent, and what drew you to this.
Right, absolutely. And like you said, my experience comes as both a surgeon and a parent. I think if you'd asked me 10 years ago when I was coming up through pediatric surgical training, if I would later focus my career on how we make surgery more accessible for people with neurodevelopmental disabilities, I would have been quite skeptical. But the reality is that it hit close to home. I have a son who's autistic, and watching him engage the healthcare system has been really illuminating to me, just what it takes to get a vaccine and the way he responds to a hospital or a clinic environment. I can think of the one patient who really started this process for me of thinking about how do we make our specific place better for neurodevelopmental disability patients was, a kid who came in with a need for a pretty simple surgical procedure, but he started acting out a little bit because he was nervous and I think overstimulated. And then the, nurses sort of escalated things with him telling him to sit down and be quiet, and that made him more anxious. And before we knew it, this kid was running down a stairway being chased by the police and ended up having to get chemically sedated to be able to go back to the operating room for his procedure. And it was a real tragedy, I think, for everyone involved, right? The patient had a horrible time. The caregivers had a horrible time. The nurses had a horrible time. Everyone was upset. And we all sort of looked at ourselves afterwards and said, there's got to be a better way to do this. And we started looking around to see, well, what are the better ways? Like what research, what literature have we not read that's going to tell us how to do this? And we realized there's nothing there. Like this is a wide open space, but it's 4% of the population. by some measures. So like, how do we address that equity issue is sort of what's been driving, my passion for this project.
Absolutely. So, so important. And you mentioned, Dr. Akins, like neurodevelopmental disorders, of which autism, I think, is the one that comes to mind when a lot of us think of these kids that have a lot of trouble. But there are others, right? So what are some of the most common neurodevelopmental disorders that listeners might be aware of?
Yeah, for sure. There are a whole host of conditions. Many of these conditions are co-occurring with things like autism and intellectual disability, but common conditions that listeners would be aware of are things like Down syndrome, which we refer to as trisomy 21, a whole host of neurogenetic conditions, Fragile X syndrome, 22q deletion syndrome, and then really there's a bunch of now, kind of named and genetically identified conditions. What's common with most of those conditions is co-occurring intellectual disability or developmental delay or language delay. And then very often sensory issues. And the one group I neglected to mention that is considered a neurodevelopmental condition is children with ADHD. Most children with ADHD wouldn't require a lot of extensive supports, but many kids that have ADHD and language delay and sensory dysregulation do struggle in a medical environment as well.
In some prior episodes, we've done a specific episode on autism. We had you with, raising the big reactors, and we've done some on ADHD. So we've talked about some of the sensitivities that kids may experience and how it can make it hard to interact with the medical system. And you mentioned, restrictive diet, trouble with communication. But Dr. Kohler, can you talk about some of the things that you see, like in the hospital setting, that really may trigger some of these children, and what your experience has been?
I think if you were going to systematically set about designing a space that was the worst possible environment for someone with a neurodevelopmental disability, like you wouldn't have to look far. You would build a hospital, right?
Yeah.
We've done it. What about a hospital isn't unfriendly to someone who, has sensory sensitivities, who has a rigid sense of timelines, who likes predictable things to happen in a predictable way, who has specific foods they will or will not eat, who doesn't like certain types of loud noises overlapping certain types of bright lights. I mean, there is nothing about a hospital that is well suited, really, let's be honest, to anybody who's trying to heal when they're ill. It's a terrible place to be sick. But I think when you have these sort of added sensitivities, it's just 1,000 times worse. And I think there really are some pretty straightforward things that we can do to make it significantly better. I mean, no one hopefully will ever choose to go to the hospital instead of their own home, but we can certainly get closer to something that's tolerable for these patients.
So, Dr. Akins, you mentioned in the beginning that a lot of these children are not getting their recommended routine screenings, maybe up to date on their routine vaccinations or, recommended blood draws. What's the data that actually shows these kids are behind versus maybe typically developing individuals? I know in my own practice, I see this a lot. I frequently think about it with like routine hearing tests and vision tests. So we usually start screening kids at 4 years old. And so it's not an uncommon practice for a child with autism or other behavioral concern, honestly, where they can't participate in like sitting there and raising their hand when the little beep goes off when you're testing their hearing. My nurses will just say like unable to complete. And a lot of times I'll see them like later at 8 or something like that. And I'm like, I ask the parent, have you ever had your kids hearing tested or their vision tested? And so, frequently the parent will be like, no, they've never been able to have it done. So that's just one experience in my clinic I see all the time. But what does the data show for these kids?
Well, you just described a bunch of universal experiences that all of us had as general pediatricians and residents, even in our developmental pediatrics clinic here at the Mind Institute, where we have very well-trained staff that work, pretty much exclusively with kids with neurodevelopmental conditions. We don't get blood pressures all the time, or we'll have difficulties just getting a weight, of course, sometimes. And maybe in like our feeding clinic here, that weight's pretty important, but that at times we're just not going to be able to get it. So the data, there's less of it than you'd expect. We know that children with autism are under-vaccinated, and we know their siblings are under-vaccinated too. This has real-world consequences for things like influenza and COVID. Of course, it can have real-world consequences for things like measles too. But we know, for example, during the COVID pandemic, that individuals with intellectual disability had a much higher mortality, partly due to vaccination. They were 2.5 times more likely to die than folks without intellectual disability. And we also know they were more likely to get hospitalized, more likely to be in the ICU, and more likely to have longer stays, and more likely to have more missed work. But then beyond that data about patients being under-vaccinated, about individuals with neurodevelopmental conditions being under-vaccinated, we don't have a lot of certainly not large studies looking at vision screening and hearing screening, and that work just needs to be done. It's certainly not the case that anybody's looked at large data sets and said hearing screening for kids with neurodevelopmental conditions is adequate, and I think, everybody knows that's not the case. But that work needs to be done. And it goes back to what Dr. Kohler was getting at a few minutes ago. There was a lot less published about difficulties accessing healthcare, broadly recommended preventative healthcare for folks with disabilities than one would expect.
So that leads us to this awesome program. So Dr. Kohler, tell us, what is the PATH program and what are your main goals, for setting it up and outcomes that you're looking at?
So the PATH program stands for Promoting Accessibility to Healthcare. The naming of it was actually a fun project with us and our big panel of advisors, including patients and parents and education specialists and child life specialists and speech and occupational therapists. I mean, all of the people who are involved in the Mind Institute's multidisciplinary care of patients with neurodevelopmental disorders, plus a host of folks from the surgery side, came together a little over 2 years ago to put together a proposal. And the proposal started small. It was, we wanted to have a list of best practices that we were going to put on a website that people who were taking care of patients in the Children's Surgery Center at UC Davis could reference to get some idea of better ways to take care of patients as they came in for operations. Very narrow scope. And we took that to the Children's Miracle Network, who has been an extraordinarily generous funder of this work. And we said, we would like to do this project. And they said, no, you can't do this project. It's not big enough. The scope of your ambition should be larger. So we actually, I've never had this happen with a grant before, but we went back to them several times, and each time they were like, no, you need to ask us for more money. So we ended up asking or getting about 7 times more than we had asked for, because I think everyone recognized that this was a huge gap, but also an enormous opportunity to really not just figure out how to take care of patients who need surgery at UC Davis, but how do we help take care of neurodiverse patients, and really by extension, all patients who need acute care, right? There's nothing that we're talking about here that's doesn't have some element of universal design. There's nothing that we do for a neurodevelopmentally disabled patient that isn't going to make things better for any patient, because it's basically like these folks are sort of sentinels for the things that are the most noxious and unpleasant about an acute care experience. And so we have done what we said we were going to do. We have made a website where we put tools and tricks for the people who work in CSC to use, but we have also trained all of that staff with an elaborate curriculum in best practices for taking care of autistic patients or neurodiverse patients more generally. We've done the same at the Glass Rock blood draw lab. So our pediatric dedicated blood draw lab is now fully trained and has a child life specialist on hand every Thursday to help with dedicated spots for neurodiverse patients. We have expanded into the Glass Rock building pediatric clinics. So that's where a lot of our subspecialty clinics are, and all the staff there has been trained. We've trained the echocardiography techs, we've trained the sleep lab techs, and we've trained the EEG techs. And we have much grander ambitions, I will say. So with every group and every training that we do, with every grand rounds presentation that we have, with every paper that we publish, people come to us and say, we want to integrate this into this part of UC Davis or to an entirely different hospital. And it's been extraordinary to watch people recognize the need and to watch the sort of organic growth as people sort of identify this as something that needs to be done. Like, we have never once had to convince anyone that this was a good idea. It's more been like, where have you been all this time? Like, let's get to it.
And Dr. Vandelist, I just wanted to add too that although this started as a local project, we've been presenting nationally at national meetings. And what's happened, really kind of coincident to our establishing this project, is a national movement really has started to take shape. And there's an initiative that was just endorsed by the American Academy of Pediatrics called SAFE. It just stands for Safe and Inclusive Care for Everyone. And essentially, they're at the stage where it's a healthcare bill of rights about what folks with neurodevelopmental disabilities should expect during hospital visits. That's interesting and helpful. And then at the same time, and believe it or not, in 2023, the NIH just finally recognized disability as a healthcare disparity area. And that kind of gets back to some of the research deficits that we were talking about before, where we didn't have great population-based data about what services folks aren't accessing, the labs and, blood draws, vaccines, et cetera. But we do know that preventative recommendations aren't being met. And so that was finally recognized as a disparity area. And that means that a lot more research dollars and focus and attention are going to move to this area. And then lastly, the other important thing that happened just a couple of weeks ago is the Joint Commission, which is the organization that supervises hospitals and certifies us, and that we have to really follow their rules. They finally are going to require that patients with disabilities, that information about how to provide accommodations they need, which might include a wheelchair accessible scale, for example. So this is for folks of all ages, but that is going to be required to be in our electronic health record now. And that's all within the last year. So there's real kind of national movement around these issues as well.
It's amazing. And we will share that SAFE Bill of Rights that you mentioned from the American Academy of Pediatrics on the website for those who may be interested as well. And Dr. Kohler started mentioning some of the amazing team members who are part of this program, including child life specialists and speech therapists. And we've talked a little bit about sort of those individual roles in the past on episodes, but can you highlight, Dr. Akins, a little bit more about what your team looks like and what they may do to help support these kids during a hospital stay or a blood draw?
Yeah, for sure. Child life specialists are probably the most important members of our team. And we should describe how, although this initiative was generated from the folks that we talked about back in the beginning and from physicians and nurses and other concerned providers in the hospital, the child life specialists really have the expertise about how to work with children to get them through challenging procedures. And they've done it forever. And they have experience with medical trauma as well. So they've been fantastic and have been the leads for a lot of our training design and have created a lot of the support materials. But nurses, speech pathologists, there's a training specialist from the Mind Institute who for many years has trained teachers and other healthcare providers about how to care for or teach and care for individuals with autism. She's been fantastic. Program managers, and then really our healthcare leadership has been quite extraordinary. This initiative is housed under a diversity, equity, and inclusion initiative at the Mind Institute, and really top down, the hospital leadership and medical leadership have been very supportive. And then most importantly of all, we have parent advisory committees. And this initiative really, once we started to move forward with it, we went to families and simply asked what worked and what didn't work, what was hard. And they said, it's hard for my child to wait. It's hard when everybody's loud. It's hard when everybody talks at once. It's hard when they insist on putting an alcohol pad on when I tell them, before a vaccine, when I tell them, if you do that, there's no way we're going to get a vaccine, right? And so those were the kind of that sort of basic information helped us to get started. And then we have a standing parent advisory committee that we meet with monthly, and they really guide everything that we do. I mean, anything that we do, from creating a new flyer or a new visual support all the way to strategy. It's really run through that committee.
I mean, I'm so happy that you mentioned that. And that's a big part of this because, it's funny when I talk to parents of kids with autism specifically, and I like it and try to provide some recommendation. It's like every kid, they call it a spectrum for a reason, right? Like every kid is so different. So we try to do something that's going to work for one child for a blood draw that is most likely not going to work for the next child. And so what is so important, and like the leader of that team is the parent who knows their child so well, right? And one really nice feature of the program that I use as a general pediatrician when I see these kids in my office and I, diagnose sleep apnea and I think, oh, you're probably going to need your tonsils and adenoids out, is that I can pull up in our electronic medical record. It's like a path form, right? And I'll sit down with the parent and I will say what are these things about your child that, it has questions, which I'll let Dr. Kohler go through. But like, what are the things that are going to make this more of a successful experience for your child?
The PATH program, one of its key features is what you described, the PATH form, which is in the electronic medical record. So it's a form that's visible to healthcare providers who are in the electronic medical record. And it just asks a series of fairly simple questions that our families helped us to design. Because like you said, parents get so frustrated when they aren't listened to. And one of the most consistent things we hear when we talk about this program to parents is this like overwhelming gratitude that someone is listening to what are actually fairly simple things, right? Just don't use the alcohol prep. It's fine, right? Like, but how do you communicate that downstream, right? So they don't have to have that conversation over and over. Sometimes it's hard in various environments to sort of be able to sit down and say, before you go in that room, here are things to know. So one of the most impactful things I think we've done with the PATH program is create this form, and it can be filled out by anyone within the healthcare system. So it can't at the moment be done by families at home, but any healthcare provider can go in and fill out this form. And it basically just outlines what are my sensitivities? What are the things I'm interested in? What things to avoid talking to me about? How do I like to receive my information? What are some, clinic or space-specific things to know? Like I've been to the Children's Surgery Center many times before, and it's much easier if I'm in one of the rooms with a door. Things that we can then look at before we go and see the patient or as we're planning for the patient to come and sort of know, okay, this guy really loves SpongeBob. This is our in, And sometimes it's as simple as that. Like, so little of this is complicated. So much of it is just identifying what an individual patient likes and doesn't like and just building your rapport around that. And it's not complicated, but you have to do it and you have to have a way to do it. And the PATH form has been really instrumental in that. And I will say, just as an aside, like Dr. Akins was saying, one really good illustration of how enthusiastic this institution is for the PATH program is, when we went to them and said, we want to change in the electronic medical record and we want to create this form. I mean, normally you like submit a ticket and you wait 2 years and then they call and tell you it's not possible. It was done in 8 weeks. And so it's been up and running for much of the life of this program and has really become an invaluable tool.
And it's one of those things that if it's been completed for the patient, you can obviously update it, but it's very clear to see. Like, that's one thing I like about it is it comes up like bright yellow on the side, like, hey, look here, It's hard to miss as a person, which is nice too, because a lot of times it can get buried and you're not going to have that information accessible. So that's been really nice as well.
And for so many of our neurodiverse patients, when people have tried to put that information in before, they put it under a violence flag. And that creates a whole host of complications for managing patients in the hospital. And it makes people reluctant to engage with them. But it's not that they're violent, it's that they have a sensory sensitivity. And like, this is a much better way to describe and act on that than the sort of traditional, like, oh, better look out, this 6-year-old is dangerous,
I'm wondering if either of you have, since the implementation, any specific patient stories of real successes that you've seen with kids.
The vaccine clinic is really a great place to start. That was the first patient-centered initiative that we started here at the Mind Institute 4 years ago now during the COVID pandemic, when, if you remember, there was real urgency and people were really afraid you couldn't leave home, right, until you got vaccinated. And we had several whole families that were unwilling to leave home. One family I'm thinking in particular had a son with intellectual disability who was in his 30s, and both parents were in their 70s. And they were so afraid that if they got COVID and passed away, then what would happen with him? And so they really hadn't gone anywhere for months. And they'd also been reluctant to get vaccinated because the sites that were available at that time were these big auditoriums, and they were loud. They had accessibility issues. It was really a factory lineup, right? You had to get in, get out. They knew that wasn't going to work. So this clinic, he was successfully vaccinated. Both his parents were successfully vaccinated immediately, and they were then able to move into less supported settings over time. But in this clinic, we do have an individualized care plan where you know your likes and your and dislikes, what your favorite items are. There's no waiting. You come in immediately. We send you a social narrative the week before that describes exactly what will happen during the clinic with pictures, where you're going to go, where the front door is, who you're going to walk by, who you're going to meet. And, I always say, if you tell us you're into Paw Patrol and Sun Chips, Paw Patrol will be on TV, Sun Chips will be on the table when you come in, and you'll get a vaccine. And the great thing about it is we're now at well over 400 patients of all ages, from young kids all the way up. The oldest person we vaccinated was 72 years old and had never had a procedure without restraint. And we've had a 99.6% success rate. And last year, 100 out of 100 individuals were able to get COVID and flu vaccination.
Dr. Kohler, anything that you've experienced?
Yeah, I mean, I think there are so many stories, and at the moment they take the form of anecdote, and I can't wait until we can say that, we decreased our canceled operations or delayed operations by X%. I mean, all this data is being collected right now. I can say that our Glassrock lab, where we have trained phlebotomists and child life specialists and dedicated slots, very much modeled on the vaccine clinic for blood draws, has been very successful. Success rates over 95%, including patients who really struggle with blood draws and who doesn't. We have seen a lot of improved throughput in our clinics because of implementing PATH in pediatric surgery clinic, for instance. We don't always need vitals on every patient. And so just identifying which patients are going to have a problem with that, or who, wants the room lights turned down when we go into clinic rooms, has definitely improved the way the clinic functions, and I think improved clinic outcomes as well. And I think, what's been most striking to me, you never know what disasters you've averted with the PATH program, right? But what I've seen is a cultural shift within the hospital to recognizing that neurodiversity and autism is a really important component of what we do. Taking care of those patients and recognizing their difference is really core to what we do. And I can think of several good examples of times with inpatients, and the PATH program isn't fully up and operational on the inpatient side, but inpatients where there's been, in both cases, autistic patients, where the primary team just thought, something is not going well here. And instead of resorting to just figuring it out or, allowing the patient to, just have a meltdown, they called me. They called developmental pediatrics consults, right? They said, we have an autistic kid and we're worried, right? And because of that, we identified a missed bowel injury in a child. Peritonitis just is a little different in a 7-year-old with autism than it would be in a neurotypical 7-year-old. So, that's a life saved. We've identified patients with, profound social needs at home who otherwise might have slipped through the cracks. We've been open to really thinking critically about how we're taking care of patients who I think otherwise would have ended up restrained for weeks on end, and instead said, could we get an ABA therapist into this room to maybe help them cope with this hospital environment they're unfortunately stuck in for a long time. And I would say that the other thing that we've seen a lot and that I've heard a lot from staff is that it's dramatically improved staff's perception of the way that they take care of these patients, right? It's stressful to take care of a neurodevelopmentally disabled patient because you're not quite sure kind of what to expect. You haven't had a lot of training, right? We know that about 50% of patients or people who take care of these patients have had no training at all. So how do you provide them with that structure? And then, having done so with the PATH program, I get told all the time, I took care of a patient today who 3 months ago, this would have been a real battle. And instead it went great. And I had a great opportunity and learned something and felt like I took good care of this patient where I don't know I would have had the tools a few months ago. So I think, all of the sort of metrics are coming in fast and furious, but the stories are fantastic.
And, another thing that I'll mention, just because we have a lot of parents who listen, and whether or not they're affiliated with our institution, probably the majority are not. I will say that, as a parent, I think a lot of times talking to them, they don't want to burn any bridges. So they're reluctant to make requests of the office or the pediatrician to accommodate their child. And I would say we welcome those things, and they actually will make our job easier. So I think of one amazing mom who just after we met each other sent me a MyChart message that was detailing a lot of these things that are on the PATH form, right? please try to take the blood pressure at the end of the visit if you need to, because that's really going to trigger him. Please do not mention vaccines in the room until the end, or ideally, like you and I would have the conversation before the child was in the room, right? Like these are such simple things that I could make like a little sticky note to remind myself every time this kid comes in that these are things that are going to make my job easier, the parents' experience easier, and most importantly, like the child to have a positive experience at the doctor. And as we've gotten to know each other and, our relationship has grown, then we can talk about things like, okay, like, why don't you buy a blood pressure cuff online and work with the ABA therapist about just like getting that around his arm and like feeling it tighten and letting go and letting him do it. And like last time we really did need a blood pressure for something. And, I had him do it on me, and then we did it on his leg, and we kind of like, we got to that. It was like an incremental step, but by knowing that was a trigger for him and not just having like the medical assistant do it right when he walked in the room, we were able to successfully get what we needed. And it did not take a lot of time. And so I will say to parents, like, if you don't have something like this, that doesn't mean that your provider is not like really open and excited about learning those things for your kid. And I would encourage you to send that MyChart message, or, to write a little note to bring into your office. Because most of us, we really do want to learn, and we go into this, especially in pediatrics, like all of us here, right? Because we want to make the lives of kids better, and we're horrified by these disparities, right? And so, I mean, I would love to hear, Dr. Akins, if you have any other tips for families, like in ways that they can advocate if they don't have a program like this.
And we've made all of the materials for the PATH program available on the pathprogram.org. So they're available on the website, and parents can access it. Providers can, really anyone can. And so things like a visual checklist, which is, you can just imagine if you were going to the doctor and the 6 steps of that doctor's visit were outlined, I arrive, and then think of that listed on a clear sheet with a little picture of you arriving at the doctor. And then you check that. Once that's done, I get my vitals, check. I see the doctor, check. All the way to the end, which is maybe a reward if the visit goes well, or even if it doesn't go well, you just get a reward at the end. You get an ice cream, or you get a toy, whatever it might be. You get to pick something at the end. That stuff is available on the website, and it's really, really, really important. I often think of a medical procedure. If I didn't know it was going to end, I didn't know why I was going there. I didn't know what the middle was going to be. If I was in an MRI, for example, and I had to use the restroom and I had to scratch my nose, and nobody came on and said, "Hey, we're almost there, man. It's just another 10 minutes." What that would feel like. And of course, it would be dysregulating for any of us, except, that's the setup for most of our patients, especially if they're minimally verbal. And so these simple tools that you can learn to use and help you learn to be a patient that can fully participate in your healthcare if you're an autistic child, that's what the program is really all about. And those are all available. Social narratives, which also show all the steps which you can use to prep for visits ahead of time. There's kits where you can practice on our website, where you can practice doing something like an EEG, which about half of kids with autism need to have at some point in their life, a test to see if you're likely to be having seizures. That's really intrusive. You put glue on your head, and then we put a blow dryer next to your ear if you're a child that has difficulty with auditory processing, and we do it over and over again, and then you have to sit still for a long time. And so having a chance to practice and learn, just like you described with blood pressure, how to do these procedures is really what the program's all about.
I hope that families, if nothing else, feel empowered to look in their area to see if there's anything like this happening. If you're a parent or an advocate, we love hearing from you, and you are the best. So continue to push those systems around you to really advocate for your child and the best care possible. Thank you guys so much for starting this initiative, and it's been really fun to see the kids in our community benefit.
That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu.
Follow us on Twitter @KidsConsidered.
And Instagram @KidsConsidered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.